Hello Mr. Meekins.
Hello.
My name is Matthew Jones. I've been asked to examine your legs if that's okay.
Yes?
Is there any pain in your legs anywhere?
No.
Okay. I'm just going to start by having a good look if that's alright. I'm going to have a feel of your legs now. I want you to let them go as floppy as possible and let me do the moving for you.
Okay.
Okay, that's great. Now I'm going to test the power in your legs. I want you to lift this leg up straight off the bed. Don't let me push it down. Relax. Lift this leg off the bed. Don't let me push it down. Relax. Push your heels down into the couch. And this one down into the couch. Bend this knee for me. Pull your heel towards your bottom. And relax. Straighten your leg out. Don't let me bend it. That's great. Bend this knee. Heel towards your bottom. Keep your leg out straight. Don't let me bend it. Relax. Pull your feet up towards me. Keep them up. Keep them up. Push down onto my hands like pedals. That's great. Just your toes now up to pull your toe up towards your face. And this toe up towards your face. I'm going to test your reflexes now. I'd like to bend this knee up for me. And this knee. And relax. Bend the knee and let it flop out. I'd like you to clasp your hands together. When I say pull, you pull them. Pull. Relax. Pull. Relax. Same with the other leg now. Just relax to begin with. Let your leg flop out. Clasp your hands and pull. Pull. Tickle the bottom of your feet now. And this one. That's great. What I'd like you to do now is to take this heel, put it onto your knee, rub it down your shin and back up your shin for me. Okay, and now I'd like you to do the same with this heel on this knee, down the shin and down the shin. Okay, and relax. This is some cotton wool. I'm just going to make sure you can feel it okay on your chest to begin with.
Yes?
Tell me if you can feel it on your leg, okay?
Yes? 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 Yes. No?
Anything there? Anything? 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 I'm going to run the cotton wool up your leg now. I'm going to ask you to tell me if it changes or if you can begin to feel it at any stage.
Okay. Yes?
Okay, same with the other leg.
Yes.
We're now going to do exactly the same thing with this pin.
Yes.
It's quite sharp, but it won't break your skin. Can you feel it on your chest?
Okay, yes?
Tell me if you can feel it on your leg.
Yes. Yes? Yes. Yes?
Anything?
No.
Anything?
No?
Anything?
No.
Anything?
No?
Anything?
No.
Anything?
No.
What I'm going to do now is I'm going to run the pin up your leg and I want you to tell me if you can feel the pin at any stage.
Yes.
Same with the other leg.
Yes.
The next thing we're going to test is vibration. I want you to tell me if you can feel this tuning fork buzzing on your chest. Not the cold metal, but the buzzing.
Yes.
Okay, close your eyes. I'm going to put it on your toe. You tell me if you can feel it buzzing. Anything?
No.
Anything?
No.
Anything?
No.
Anything?
No.
Anything?
No.
On your hip now. Anything?
Yes.
Yes. Same with the other leg. Tell me if you can feel it buzzing. Anything?
No.
Anything?
No.
Anything?
No.
Anything?
No.
Feel it on your hip?
Yes.
We're going to test now the position sense in your toes. I'm going to move your toe downwards or upwards. And I want you to close your eyes and tell me which way it's going.
Down. Down. Up.
Okay, onto the other toe. Have a good little look first. This is down, this is up. Tell me which way it's going.
Down. Down. Up. Down.
Okay, that's fantastic. The last thing we'd like you to do is walk for us. What I'd like you to now is stand up for me.
Yes.
Face me and stand perfectly still. And now close your eyes. Okay, open your eyes. What we'd like to see now is you walking down towards the bin. Turn around. Back towards the curtain for me. At the curtain you could turn around and stop. And then on the way back, could you walk as if you were on a tightrope for me?
Yes.
That's great. Thanks very much. Have a seat. Okay, that's the end of the examination. Thank you very much, Mr. Meekins.
Thank you.
When asked to examine the lower limbs, it's really important that you make sure you see the patient walk. That can either be done at the beginning of the examination or at the end. Overall, I'd probably suggest doing it at the beginning, because that way you get any extra information from seeing the patient walk and you won't forget to do it at the end if time is short. Similarly, it's really important to spend a sensible amount of time observing the patient. In the case here, it was well worth making sure that the patient was adequately exposed because doing so revealed that he had a subcutaneous insulin pump attached to his belt. The other thing about doing the lower limb examination, particularly in a case like this where you found some sensory deficit, is to go on and examine all 4 sensory modalities. The examiners will expect you to do this in the exam. This gentleman had evidence of a predominantly sensory, symmetrical peripheral neuropathy. He had a stocking distribution of sensory loss. Power was normal except for mild weakness of right extensor hallucis longus. His gait was essentially normal, although he did have mild difficulty tandem walking. Romberg's test was normal. During the examination, he was noted to have finger prick marks suggestive of testing for blood sugars, and it was also connected to a subcutaneous pump, which is likely to be insulin. Therefore, the diagnosis in this gentleman is likely to be a diabetic polyneuropathy. Whenever you finish your neurological examination and start to present to the examiners, it's probably good form to tell them that you'd go on to examine the rest of the neurological system. However, in this case, you've noticed signs consistent with a sensory polyneuropathy, and additionally you've noticed that he's got a subcutaneous insulin pump and he's got finger prick marks. So the diagnosis is almost certainly diabetic polyneuropathy. Under those circumstances, the examiners are likely to ask you a little bit about the management of his condition, and you might want to mention such things as, rather than looking for a urine for blood glucose or a fasting blood sugar, you know he has diabetes, it would be more useful to check his HbA1c to see what his control has been like over the last few months. You then may have to go on and speak to the examiners about symptomatic treatments for diabetic neuropathy, which usually is along the lines of treatments for pain, things such as tricyclics or using anti-epileptic medications such as gabapentin to control painful neuropathies.